do you, for people who are whole food, plant-based diet eaters, do you recommend they still get check health scans to check the health of their arteries? And if so, which ones?
I think this goes for all people. There is no reason to get a scan of your arteries unless there's a clinical indication to do so. And when you say scan of your arteries, I'm not sure exactly what test you are speaking of. Is there a specific test you're inquiring about?
I don't want to misquote Dr. Joel Kahn. I thought that he said, and again, I don't want to misquote, but I thought that he said for certain people, there's a certain scan. I don't remember which one that he was recommending. So I guess I don't really know.
I think I do know from reading some of Dr. Joel Kahn's things. He pretty adamantly recommends that people get a coronary calcium scan. And I believe that some of the things that I've read online, he says everybody over 40 should have a coronary calcium scan. And our American College of Cardiology, American Heart Association guidelines do not take that stance. A coronary calcium scan is basically a fairly low radiation CAT scan of the heart that counts the pixels of calcium in the coronary arteries, and it can help to better risk stratify people. So if you have zero calcium in your coronary arteries, that's pretty good. It suggests that you don't have any calcified plaque. It doesn't say you have no plaque, but it means you have no calcified plaque. And that would indicate that you would be somebody who over the next 5 or so years has a exceedingly low risk of heart attack or stroke. And typically we use coronary calcium scans in people who otherwise we want to better risk stratify, so that we can better guide them in terms of our treatment of them, whether it's just that we recommend healthy diet, whole food plant-based diet, or we recommend whole food plant-based diet plus potentially a statin and plus potentially an aspirin. So that's what that test guides us for. I certainly have had sent plant-based patients for calcium scans when the clinical indication was there. But it really is a person by person situation.
Okay, thank you.
Well, there is an interesting situation that arises as we talk about how to manage patients who perhaps are asymptomatic. Remember, there is a kind of a fascinating study, the pathobiologic determinants of atherosclerosis in the young, 1999. And this was a study where they looked at a number of young women and men between the ages of 17 and 34 who had died of accidents, homicides, and suicides. And at the time of the autopsies, coronary artery disease was now ubiquitous. Nobody is escaping. So in a sense, you know, you have to think that when we are making these recommendations for patients who do have symptomatic coronary artery disease, and I know I've found myself for decades making a distinction that said, oh, no, if you don't have heart disease, you don't have to do what I've asked these patients to do. But remember this, every single patient that any of us has ever treated was at one time normal. So are we really overlooking the huge population of patients who really, although they haven't yet developed their heart disease, they're the next ones on the block, because we know that everybody eventually, by the time they're 65, everybody has cardiovascular disease that you can see with careful study. This is the work of Robert Keller, who is the professor of public health at the University of Pittsburgh. So I think it raises a sort of a philosophical question whether we really shouldn't be offering all patients this, because I find myself increasingly getting sort of frustrated with the two major cardiovascular institutions, the American Heart Association, which was devised in 1924, and the American College of Cardiology, which was developed in 1949. Now, they recognize that we have this epidemic of cardiovascular disease, but we've also known for 100 years that there are multiple cultures on the planet where this disease is virtually non-existent. Why isn't it the responsibility of these institutions to bring what is hardly a secret as how it is that these other nations never seem to have any cardiovascular disease? Why are we overlooking that? Why are we using pills, stents, and bypasses, which have absolutely nothing whatsoever to do with the causation of heart disease? Why are we using that when we've known for 100 years that there are ways that this can be avoided with a cultural transition to the way these other cultures are eating? Am I missing the point here, or somebody else want to comment on that?
That is a perfect, that's a perfect point to make. I totally agree with you. I have the same question. Why are we having so much difficulty for so long to even understand the concept of nutrition?
Well, I hate to raise the idea that it could be money, but I remember asking a cardiologist once why he didn't send more patients for counseling on nutrition. And he said, "Do you realize that my billed charges last year were $5 million?" I said, "Now I understand."
Yeah.
Okay, thank you. If you'd like to ask the
Heather, I'm not picking on you.
No, you're not, but understand that we get 15 minutes with a follow-up patient, and I do my damnedest every time I see a patient. We talk about nutrition, we talk about exercise, but there's often other things that come up that we have to address in that limited amount of time, and it's hard to get that message across, even for those of us who are the most well-meaning.
Well, let me just, I want to, now that we're on to this, I got to guess who the sponsors are for the American Heart Association. Ready? The Nebraska Beef Council, the Colorado Beef Council, the Idaho Beef Council, the Texas Beef Council, the South Dakota Beef Council, the Kentucky Beef Council, Subway, ConAgra Foods, Domino Pizza, Farmland, Passion for Pork, Cargill, Tyson, Unilever, Mars, White Wave, Kraft, Kellogg, Pepsi, Dairy Max, General Mills, Purdue, and Nestle. Am I missing something? What do those sponsors have to do with getting rid of heart disease?
No, I understand exactly where you're coming from, and you make a good point, but I think that those of us who are well-meaning cardiologists are not pushing our patients to drink Pepsi and eat Subway.
Why are they? I just, yeah. I
think you're looking at the sponsors of the American Heart Association's Heart Walk, I believe.
I'm sorry, I didn't hear that, Heather.
You're looking at the sponsors of the American Heart Association's Heart Walk. Am I correct?
No, I don't know about Part Walk. I don't know about, but I know this is something I just simply looked it up.